And welcome to our live stream. I'm Dr. Deuk. Our patient has facet joint pain in his back, second most common cause of back pain. Facet joints are small diarthrodial joints. Everybody has them. You have left and right facet joints for each disc. We all know about the discs. Very few people know about facet joints. And we're using the X-ray machine to identify the facets. All right, our X-ray machine is having some issues. Shot. All right. Very good. You can see the tip of that probe on the left and my fingers on the X-ray, and they are in the perfect place to deaden the pain nerve. So that's number 3. That's the transverse process of 3 shot. Now I'm going to go to 4, which is just below my probe. Hopefully you can see that.
We can.
Shot. And so if you look at the tip of my probe, it's literally sitting on the exact perfect spot for doing this procedure. And there's a pain nerve there called the medial branch of the dorsal ramus. And that nerve, well, it takes all the pain from that facet joint and transfers it up to your brain. So by cutting the nerve and killing it, which is what a rhizotomy is, shot, we can eliminate pain from the facet joint without having to go through major surgery. All right, I crawled out laterally on the transverse process. Let's see where we are. Yep, very good. Any questions about this procedure?
At this moment, no current questions.
Now remember, the RFA is another way to do this, but it doesn't work. So that's why we don't do it. The RFA has been around for a long time. Shot. Unfortunately, the RFA, if anything, it gives a temporary effect. Some people, well, since it's covered by insurance, they want their insurance to do it, to cover it, and they do an RFA. But they always end up coming back. Shot. Should be it. Shot. Yeah. I think we're just about done. Let's do the other side. We're just about done. Shot. All right, any questions?
At this moment, no current questions.
And this procedure is done with a 4mm incision. So it's tiny. There's just a few drops of blood, and it's outpatient. Patients don't have to go to the hospital for this procedure. We do it right here at our surgery center. Shot. Shot. Beautiful. 2 more to go, Dr. B. Yeah, I can feel the scar tissue from his arthritis. We were talking earlier, and he said he's had the RFAs done, they stopped working, which is pretty common to hear that. Shot. The reason they stop working is all the arthritis tremendous amount of scar tissue from the arthritis. Shot. That scar tissue gets around the facet, and then you just can't get down to burn the nerve, because that nerve is buried in scar tissue. Effectively, it's got a shield around it. Man, that is a lot of scar tissue. Shot. I'm in the right spot. Shot. All right, one more to go. Shot. It's all right. Shot. You can see the transverse process. Shot. Right on this perfect spot. A little bit below. Shot. And that's it. Again, really thick scar tissue here. Good job, everyone. Let's show the incision.
Can I shout out to Mark because he's watching now?
Hi, Mark. Shout out to you from Dr. Berndes. So there it is, 4 millimeters. That's the Deuk plasma rhizotomy incision. And again, what's different with RFA? It doesn't work or it's temporary. With the Deuk plasma rhizotomy, it's permanent. And it works. These incisions are from laser on the disc. So we did the 3 disc areas that were painful, and we did the 6 nerves to the facets, the pain nerves. We got rid of those. So he should have 95% of his back pain gone permanently. I think tomorrow morning when he comes in, he's going to be a happy man. Good job, everyone. Any questions?
Yes, we have about 2 questions. This first one coming from Michael on YouTube, first asking, would the facet pain the patient feel be the same pain as a herniated disc?
It's not the same pain as a herniated disc. The herniated disc pain comes from the annular tear, which is literally 5 millimeters away from the facet, and the facet pain. They're so close. Facet pain is typically right or left, and it's about 2 finger breaths off the midline, the dead center to the side, 2 finger breaths. And more importantly, when you push on the facets in your back, you'll feel sore. It'll hurt. With the disc, you never feel soreness when you push.
And then lastly, our question from Lanu on YouTube asking, have you ever gotten angry during the operation? For example, a piece of herniation is running away from your laser.
Oh yeah, I get angry a lot. I don't get angry as much anymore as I used to. But yeah, I get frustrated. I'm just like everybody else, I have my moments, and I'm not perfect by any means. I try as much as I can, but my impatience is probably one of my biggest weaknesses. I like to get things done and move on to the next challenge. So, well, thanks so much for joining us. You've watched the Deuk plasma rhizotomy for facet joint pain. It was short and sweet, 1 incision on each side. We fixed or killed 3 pain nerves on each side. And we had a shout out to Mark or Matt? Mark. Shout out to Mark from Dr. Berndes. Have a wonderful day. We'll be back next week. I want to thank my team. You guys are amazing. You guys are the best. Thank you. Thanks, Henry.
Not a problem.